Welcome back, everyone. It's a pleasure to welcome our distinguished speakers to this panel discussion, which will focus on how we can improve coordination and uptake of newborn screening across the EU. I think we've heard this morning about, on one hand, the variations that still exist across the member states when it comes to newborn screening programs, but also about many ideas on how we can move forward and ultimately improve and ensure equitable access to newborn screening for all babies born in the EU. I think importantly, we've also heard very strong supportive words from both the Minister of Health of Slovenia, Dr. Poklukar, but also from Dr. Manuel Pizarro from the European Parliament, and I think this is very encouraging. I will now pass the end to my co-moderator today, Dr. Peter Skielan from ISNS, and Peter will welcome, I think, 3 additional panelists who will join us for this discussion.
Yeah, thank you so much, Johan. And yes, we do have 3 panelists that we haven't heard this morning. Hopefully we're able to have just a very short introduction. I would like to start with Mrs. Konečná. She's a European Parliament member from the Czech Republic. And Ms. Konečná, if you would be able very shortly to answer this question, how did you get involved with newborn screening and how did you arrive here today in this panel?
So I'm as one of the member of the mission of the interest groups. That means that I hope that I could speak. So from my colleagues who are in this interest groups, maybe it's very important for you that the mission of this interest group is to advocate for newborn screening. That means that you have a big support in the European Parliament. In EU cooperation of newborn screening for rare diseases is still an underdeveloped area, and we must work on it. Normally, as you know, what means interest group, because this is something, but it's not so known inside outside the EU or a European Parliament. The task of each interest group is to bring together like-minded MEPs, and we usually, for example, submit joint amendments with my colleagues, or we organize various seminars, or we submit common proposal for pilot project of the Commission. Also, we are drafting common written or oral question of the Commission. However, I have to admit that the functioning of this group highly depends on the mutual personal contact between MEPs. Yeah, it's true, which is currently in this time highly problematic. But we hope that everything going back, and most of the activities of these groups, not only our groups, but these groups have rather stagnated over the last year. But nevertheless, as the pandemic situation improves, their activities can be expected to resume. Yeah, that means that what I can promise you that we going back to Brussels and Strasbourg. I hope that from November everything will be stabilized, and we start work, and we start doing some things what we need to do, because yes, the truth was that the last 1.5 years was a difficult communication, and we, as in another topics, yes, you're doing only what you need.
Yeah, thank you. Well, certainly you have done already a lot for the Screen for Rare initiative, and we're very thankful for that, and thank you for that kind introduction. We're moving over to Mirjam van den Burg, who is a Dutch colleague of mine. And I do think I can say, Mirjam, that, that you're relatively new in the field of neonatal screening. So my question to you, apart from giving a very short introduction of yourself, is how did you end up in neonatal screening in this field? You're very important for one of the work streams on case definitions. And how do you like the field? So
No.
very short answer to very short question.
Yes, okay. Thank you, Peter. Now, my name is Mirjam from the Burg. I'm an immunologist working in the Leiden University Medical Center. I have done a lot of research on severe combined immunodeficiency, and I did a lot on the diagnostic work. So I enter really the field in newborn screening as from the diagnostic and the research point of view. And the question, how I perceive the field, I think it's very fascinating. And it was already the last years when I led the implementation pilot study in the Netherlands. It was really fascinating how the two worlds of diagnostics and screening came together. And I think that's fascinating for both fields. And I think there's also a lot to gain to further improve the newborn screening. So from the screening point of view, but also, let's say, we as immunologists and more research-oriented people, I think it's really important to join forces, especially also in the context of the ERN, to bring the field forward.
Good. Well, thank you very much for that. And thank you already for all the effort you've put into the field. And let's see where this discussion of today is going to bring us. And meanwhile, our esteemed colleague from the Netherlands, Eugenie Dekkers, has managed to find your camera. Eugenie, you missed the introduction. No, I think you heard the introduction. So just a few lines on who you are, what your function is, and then your short answer on a short question would be, how does Europe affect the Netherlands, the Dutch neonatal screening program, and how do you expect it to affect in the future?
Yes, thank you, Peter. I am Eugenie Dekkers. I'm the program manager of the newborn screening program in the Netherlands at the RIVM Center for Population Screening. And we are running quite a broad MBS program of 25 conditions in it, mostly metabolic diseases, but also sickle cell, thalassemia, SCID, endocrine diseases. And now we are working on starting a program for spinal muscular atrophy, and we try to start that in 2022. And we're also looking into using NGS techniques in our MBS program. So I think we are in a condition of huge challenges and many innovations in our MBS programs. I think that is the main perspective why it is so important to have this international cooperation with each other and to have this European perspective for all of us included, and to see what our colleagues and our experts in other countries are doing, are learning, and that we can learn from each other, and even making our programs stronger and better and making it a real MBS system, because I think that is what is needed, and that is why it's so important also about this European meeting. So thank you very much for this.
Thank you very much for those encouraging words. And before Eugenie, and then before I give the floor to Johan, this is really for our audience. I heard that meanwhile we may have had 130 registrants, which is really so we're quite happy with that. If you have a question to the audience, to the panel, to one of our panelists, please type in the question into the chat box, and we'll try to answer those questions in our last part of this meeting, where James Bonham is moderating a session with the audience. So Johan, back to you.
Thank you very much, Peter. So we'll kickstart this panel discussion with one question. I think it was clear from all the presentations. We talked about some of the differences in terms of newborn screening programs around the member state, but also some of the solutions. But a couple of speakers also touched upon the fact that we are really awaiting almost a revolution of the newborn screening field with genomics potentially changing how newborn screening may be carried out in the future. So a first very general question would be, is this a special momentum? You know, are we at an important turning point in the newborn screening journey? And would that be an additional reason for the EU not only to take a role to try to help with better coordination, but also to take a role for making sure we are prepared as a European Union for the future. And I'd like to turn this question to the whole panel. So feel free to raise your hand if you want to start. And if not, I think maybe I will ask a couple of people myself. Anyone would like to volunteer for this first question?
Maybe me, because yes, it's true that it's about the EU and maybe a little bit European Parliament, and I want to be open. Yeah, you know me, and I not like it. It is political answers. That means that I will probably disappointed you a little here, but the European Parliament cannot do much more on this area than has already done, because we are now basically moving on the right edge of the possible. The problem is primarily EU law, and neither we nor the Commission can order member states to provide these screenings. We can send them more and market funds just for this, but the member states themselves would have to do this and send more money into the EU budget. And we can, of course, put together a proposal with the Commission, which would state in a non-binding manner that such screenings should look like, etc. But that is all. And we cannot even harmonize the design of these screenings. Yes, it's really impossible. And the Council can, for example, update its recommendation on rare diseases from 2009. In terms of implementation, member states will face the lack of funding. National healthcare systems are completely depleted after the pandemic, and budgets are tight. And according to proclamations, the fight against cancer is a higher priority now. Yeah, it's not from my side, but it's reality where we are. And the budgets are tight, and according to proclamation, the fight against cancer is really something what it's the top. Yeah, I understand you and your position, and really, please believe me that it's not from my side a good decision, because I think I understand why cancer is so important, but in the other side, I know how many other diseases we have it in a EU, and all these diseases, nothing is preferable or not. Yeah, we need to help anybody, but the truth is that if you see on the funds, if you see on the money, on political statements from, for example, Madame von der Leyen and all these people. You can see that it will be very difficult work. But in the other side, from my side, I promise you that we're doing anything what it's possible. Yeah? But I don't want to give you some best answer and say, okay, everything will be next year the best, because we have a big issue there. One is a primary law, and the position from member states, and the second needs to be more in a council of EU, not in a European Parliament, because I think that from European Parliament you have a support, and we support you. But now the concrete steps need to come from member states and from Commission, and especially from their budget.
Well, thank you very much, Ms. Konečná. And I think absolutely agree. I think navigating the policy priorities at EU level will be very important. And I think that's exactly why the MEP interest group on newborn screening will be important, because it does provide a platform where we can bring together all European stakeholders and try to move forward. And of course, today is a testimony of a member state prioritizing the topic, which we are highly appreciative about. Perhaps I'd like to pass on the hand on the same question to either Professor Bonham or maybe Professor Scarpa, if they have additional observations with regard to this momentum and why we think the EU should get involved, and also how should the EU get involved.
Yeah, I can start. I think your question, Johan, was particularly does the genomics revolution bring something different? And I think the answer is that it does. And that's why it's important that we organize ourselves and ensure that we don't take missteps, ensure that we take advantage without going down a wrong route. And it's different because, of course, it's slightly further away from the patient. So when we begin with a clinical presentation, we have, if you like, a clinical prior before we do any laboratory investigations. Screening doesn't do that. It starts with an asymptomatic child. But of course, there are biochemical disturbances which are nearer the phenotype of the patient. And even with that, sometimes it can be a little confusing in the way that Stefan was talking about earlier with isovaleric acidemia as an example, where the biochemical finding doesn't necessarily equate to real disease. And as we step even further away into the world of genomics, then of course that can bring new challenges and new uncertainties. And so I think we've got to be very careful of that. And of course that sits alongside huge commercial interest, because of course the means of detection that genomics offers is also accompanied by a means of treatment that genomics offers. And these are very expensive treatments. And what that means is profound commercial interest. And of course, provided that commercial interest is handled in the right way, it can bring great benefits for our societies. But if it's handled in the wrong way, it can be not just an economic burden, but also sometimes a burden of uncertainty for the families that have been touched by this. So I think it really is absolutely crucial that we act, and not just act as individual nations, but act corporately together as a European community, and to develop clear guidelines, to have a clear and unbiased place where we can discuss and take advantage of the good things that genomics has to offer, but perhaps express some degree of caution when that may be going in the wrong direction. So there's never been a more important time to work together because of genomics, to exploit the benefits, but to avoid the pitfalls.
Thanks so much, Jim. And I see we have a couple of people who've raised their hands. I'll go not in order of preference at all, but in order of the pictures on my screen. So starting with Maurizio Scarpa, please.
Thank you very much. Yeah, congratulations also for how the meeting is conducted. And it was very clear, very precise, and very important messages have been delivered. Regarding the question you had, Johan, regarding the gold momentum, we are indeed in a gold momentum because we are here today with all these stakeholders and so many MEPs, and the moment of collaboration and to create really a unified effort on this important health action. We are in a gold moment, but I think that we need to be very careful because, I mean, as Mrs. Konečná was saying, probably we are not ready now to have a European newborn screening program. We need still to work. And this meeting today is stating that we have the basis, that we have the platform to do. We need to be very careful in which kind of technology we want to use. We need to also be very careful in how many diseases we want to use according to the therapy availability. So there are quite a lot of issues that we have indeed still to discuss. And we have the time now to prepare this discussion in order that also the European Commission and the European Union is ready for that. So I think that we should not cut angles, but we should actually now from today, having formed this task force, start a discussion, which is a continuous discussion involving all the stakeholders and having the patients with us in order to prioritize, to identify first the needs that are still open, to prioritize actions and to create really a very reasonable way to go. Because it is true that there are countries which are really example and piloting the newborn screening, like Italy, for example. There are others that are willing to do, but probably do not have the tool yet. And we have the ERNs. As I said, the ERNs are really a sort of collaborative network that can really be used also to cover and to speed moments. Especially now that we are going in the second 5-year program, we can really ask to the ERNs together with the member states and the patient organization to identify a program inside each ERN, in order that each ERN has a specific task for newborn screening, because it is not only biochemical, it is a lot of genetics. And all the rare diseases are taken care by the ERN, so to design a program that will expand for the next 5 years in a very coordinated way. And this is a message that I will bring to the ERN coordinators group, because we have one group which is working very intensively all together in order that this action is forwarded and it is actually expanded together with the marvelous platform we have constructing today, with the societies, the SNS, with Lordis, with the ERNs, with the state, with the members of the parliament, with the expert that can help in designing the way.
Thank you, Maurizio. I absolutely agree with you on the role of ERNs, and I think we'll have the opportunity, hopefully, to discuss more specifically some of their actions. Jan Lecam had raised his hand as well. So Jan, please, the floor is yours.
Thank you, Johan. To follow up, in fact, on what Maurizio was saying also, and on your question, the momentum is clearly in the screening technology with the genomic revolution, as Professor Bonham elegantly explained. Also, the fact there is new treatment technology coming in, and often with potentially a curative effect, and where the optimal outcome of the treatment is when it is associated with a newborn screening, because it's before the appearance of the first symptoms. So that's a game changer, and that's a new conversation around newborn screening. Also, the growing differences, which we heard very well this morning across EU, but also more broadly across Europe, which from a society standpoint, from a patient family standpoint, is just not understandable. Hearing that we still have an ongoing process of pilots for cystic fibrosis in Sweden, when cystic fibrosis is being tested, screened in other countries already since 30 years in pilots at that time, it's just difficult to understand. Now, there is other elements of momentum. The European reference networks are changing the game, because we have network of experts to discuss the good clinical practice and the benefits and risk of newborn screening. So we have a pooling of expertise. But there is also a new important element, the new European HTA legislation. And we have not mentioned that until now. In the scope of the collaboration on HTA at European level, all the technologies linked to newborn screening is completely eligible. So instead of having conversation in respective national HTA agencies, 60 across Europe, we will have it in the future within this European collaborative framework. And that's a major difference. I'd like to insist on that, because it means that it provides us the framework to discuss the level of evidence which is needed to inform the decision at national level, which gives us the opportunity to coordinate the efforts of the pilots, rather than repeating the pilots as we're doing from one member state to another over a period of 10 to 20 years. I'm pretty sure that there is a better way to use our time, or money, and our capacities of human resource capacities into the health systems. And the reason to collaborate at European level is obviously the standards. So here we're talking about harmonization, but it's very much bottom up. It's from the professionals who elaborate these standards, either from the societies on newborn screening or from the ERNs, and also to exchange or practice around the process. Each of you insisted about the importance of the process, the organizational aspects, and we know how much important they are. And here there is a lot of peer-to-peer learning across member states, and that really technical level and bottom up. But the biobanks are very important, and this is the critical mass of Europe. It's an opportunity we shouldn't miss. And here in these two areas, maybe there is a role for GRC to play. GRC is responsible for quality and quality assessment and helping member states with that. So it's not a top-down approach. It's usually very much a bottom-up approach, as we have seen in cancer, for instance, for screening of breast cancer, just to take one example, or early diagnostic of breast cancer, I should say. Having a platform or a steering committee of experts with stakeholders involved. By stakeholders, I mean ERNs, patient representatives, maybe other we have to see, is absolutely essential to maintain the momentum of today from this workshop. And I really praise the Slovenian Presidency for this initiative. And to conclude, from the top-down approach, what the European Commission can do by including newborn screening within their work program of EU for Health is to support that steering committee, is to support this exchange of best practice across member states. And here the SGPP can play an essential role, starting from few member states which are ready to collaborate more together before scaling up across Europe. Also, they can fund research activities or activities between professionals on the methodological aspect and the funding of the evidence on the pilots. So funding the pilot to generate the level of evidence to inform decision-making across Europe. That's cost-effective at the European level. And last, the non-binding legislation that was mentioned by your Slovenian colleague today, non-binding or Czech Republic, is that non-binding legislation is useful. So EU can also develop a non-binding legislation down the road to make recommendations in order to really encourage it to be more thorough across. Thank you.
Thank you very much, Jan, for all these additional very good points. I think Eugenie as well has raised her hand, so I'll pass on the floor to you.
Yes, thank you. I also wanted to give one more reflection on this momentum that we are seeing, because also with us in the Netherlands, we see this momentum for newborn screening at a European perspective. We started a vision project for our MBS program with our Ministry of Health to look into the future of newborn screening for 10 to 15 years further. Because we see all these developments with new techniques, NGS, new innovations being possible for our MBS programs. So this is what we start to look into creating a more strong and viable MBS program in the Netherlands. And our Ministry of Health also asked us to look into European experiences. So experiences, developments, models in other European countries who also have these MBS programs, to see what we can learn from this and to have this also available for this vision project into a more viable MBS program in the Netherlands. Thank you.
Thank you very much. And I think, I mean, obviously a great discussion ongoing. Maybe to come back, we've mentioned, and Maurizio and Jan as well have touched upon the role of the ERNs. Now, we know that the ERNs recently launched an expert newborn screening platform with several ERNs really fully engaging in the initiative. Perhaps I'd like to ask Jim to provide just a quick overview of the different work streams that have been agreed, and then maybe Peter can follow with some questions on some of these topics with some of our speakers who are very much involved, before we perhaps come back to more policy-oriented discussion. Hopefully we have time.
Yes, thanks, Johan. We've distilled this down to three, just to get things beginning, three important and key work streams that have come out of that work with the European reference networks, and we hope to develop within Screen for Rare and indeed on a wider stage as well. And those three are building upon the work that Gerard Löber and Peter Schillen have already done at looking for practice of newborn screening, not just the number of conditions, but also how the program is run and organized across Europe, and see whether we can develop that and learn from one another. And this is part of that process. It's really learning from good practice. So for instance, just as an example, we heard this morning from Giancarlo Lamarca about the importance of second-tier testing to improve the positive predictive value and avoid false positives in the Italian newborn screening program. And that's something which should become standard across most of Europe. And we need a strategy to work out what that would mean for our programs and to develop that to include not just the number of conditions screened, but also the quality of that screening. So that would be a piece of ongoing work. How can we learn from one another? How can we improve governance? How should we be monitoring our programs? The second is key, and that's being led and coordinated by Mirjam, but clearly with input from others. And that is, how do we define the conditions that we identify? It's seemingly obvious, but as Stefan dramatically highlighted this morning, the term isovaleric acidemia means different things depending upon the type of condition that's identified. And just how do we define the conditions that we identify at screening leading to treatment? It's seemingly obvious, but we don't necessarily have agreement. We certainly don't have agreement across the world, and we don't even have agreement across Europe. And that's pivotal to think of how we then go on to develop screening and treatment for those conditions. And then the last is the important emphasis upon outcomes. It's remarkable that we've been doing screening for 50 years, and we're only now beginning to look in a systematic way at the impact that that's having in the lives of children who've been touched by that. So that's got to be a key part of our work, because it's when we can demonstrate that impact that we kindle the interest of our health policymakers. And so that work, which again Stefan mentioned this morning in Germany, but it's not just going on in Germany, it's going on in other countries across Europe as well. In the UK, we're having a renewed emphasis upon the importance of outcomes. And so we want to work with that. So it'll be those three areas: identifying good practice, being clear about what we mean about the conditions that we identify, and then looking at long-term follow-up for some of these cases so that we can demonstrate the impact and benefits, and also learn how we might improve newborn screening programs.
Thank you very much, Peter. Perhaps I should hand back to you for some follow-up questions on these matters.
Yes, Jan. Well, first of all, there is room for the panelists to comment on these on these work streams. I see hands from Victor, surely, and from Mauricio. So we'll start with Victor. Thank you, Victor, and then Mauricio.
Thank you, Peter. I have still one comment on the genomic, on the use of genetic technologies. We all here in this panel discussion are convinced about the importance of newborn screening program. But about 5 to 10 years ago, there was a campaign throughout Europe where part of population actually questioned the possibility of using dry blood spots for any genetic testing and for misuse of the data. So I'm just making a note that if we are talking about the stakeholders, we should probably involve a larger population, not only those who are involved in screening and patient organizations who benefit from screening, but we should also listen to the other part of the population, as we do see it now, for example, in COVID vaccination. The second point I wanted to comment was that of Jim Bonham. I'm just wondering whether we can define cases without knowing the outcome and the clinical benefit we are doing. So I'm just asking whether this is not actually intertwined. By having the data from long-term outcome, we can retrospectively define what is the case. Thank you.
Yeah, well, absolutely agreed, Victor. And while designing these work streams, we on many occasions came to the conclusions that even the work streams are intertwined. And there's data from one work stream that is necessary for the others. So quite agreed on that. Also, you mentioned genetics, and I see in the chat box that we receive a number of questions now on genetics and newborn screening, genetics in particular, and it seems to me that that especially is a subject that you want to address on a European level, as you yourself mentioned in your presentation that you're now trying to change the law to make it possible for genetic screening to be introduced. There's also regulations in France. David could maybe allude to that. I think you need to ask specific consent for genetic screening, don't you, David? Wasn't it the case with cystic fibrosis screening? This is a question to David Schlemm. Your mic is off now, David. David, your mic is off.
Sorry. Thank you, Peter. Yes, but the discussion in France about genetic screening for cystic fibrosis is quite different, because it was in the beginning of year 2000, and the place of genomic was quite different. And when we start, the discussion was we have a first-tier test with a biochemical test, and after that, we plan to add the genetic part. So I think that actually the question is very, very different, and the acceptable of the genetic screening in the general population should be really different. And with the time, we have a number of parents refusing newborn screening, increasing in France. In the beginning, it was just maybe 10, 20 per year in France. And actually, it's maybe several hundred, in part, I think, due to the genetic screening. So if in the future you had a global genetic screening as a first tier, I think that a part of the population should refuse newborn screening for each disorder. So it should be a problem for the future.
Yeah. Okay. Well, believe that I'm pretty sure that we will not finish a discussion on genetics and newborn screening in this panel. But what I do think that there's so much room needed for this discussion that maybe at some other point we need to organize a special event on this. But I do, and I also think that this is a message to Kateřina, that there's so many questions on a national level already, and so many diversity, given all the subjects of neonatal screening, but especially in this emerging field of NGS, that there's grassroots initiatives as we're looking at one today, but some guidance from Europe is so much needed. So any help you and your colleagues can give us in that respect is much welcomed. Now, maybe one short comment from you, Kateřina, and then I go on with Mirjam, and then Jan, and then Mauricio.
Only short comments. Yes, as I said in the beginning, I hope that we start new work in our interest groups, that I will contact the colleagues, Mr. Pizarro, and I think that if you will have this input, please give us, and we will contact you and discuss with you what will be the best here, because we have some possibilities what we can do. Something is better, something is not so, but we can give you some options, and I think that we will discussing this in the end of this year or in the beginning of next year. Yeah? But I hope that in the end of this year will be the time to discuss what our interest group preparing for next year, and this topic could be one of the main issue from our side. It means that I promise you that we did it. We do it.
Well, please make a note already, and we'll come back to you. Thanks for that, Kateřina. And now Maurizio, Jan, Mirjam, and then Giancarlo. And then maybe just a short break to see where we are and how we proceed. Maurizio.
Thank you very much. The discussion is very interesting. On the clinical side, as a metabolic physician, I would like to stress the importance of to consider newborn screening as a system, and not to concentrate only on the technology. The newborn screening is involving also a lot of other disciplines like nurses, like obstetricians, gynecologists, and psychologists in order to assist the family. This is something that is becoming more and more urgent because there is quite a lot of awareness. There is a lot of expectation in the general population from newborn screening. But we need to consider the newborn screening inside a major action which is surrounding the birth. At the moment, I have to say there is still quite a lot of lack in awareness on disciplines like gynecology, nurses, and psychologists. And what we are trying to do inside the ERN is indeed to involve these people in order to create a course and to discuss newborn screening directly in the pregnancy. Before the birth, which is the moment in which usually the discussion of newborn screening is done in most countries, and especially to follow up the families, not only when they have a sure diagnosis, but also when they have a suspect, because unfortunately the newborn screening still has a small percentage of recall, which is creating a real drama in the family. And this is something we need really to take care together with the expansion of genetics and other technology.
Okay, thank you for that comment, Maurizio. And then Mirjam.
Thank you, Peter. I would like to continue of the vision Jim Donner made about the different work streams, and I really agree that they are really interconnected. And what I would like to add on that, we've been working on the case definitions for severe combined immunodeficiency for SCID, and Rolf Zetterström was also involved. And what we did, we sat together with screeners, immunologists, clinical geneticists to talk about the case definitions. And I think the way we did it, so to talk with others, to also did a systematic review from literature, which terms are used, and then finally coming up with case definitions for a disease, not only by the clinician, but also by the screeners. And I think this way of talking together is, I think, very important for the field of newborn screening, because if you have uniform definitions, only then you can make fair comparisons for the strategy, but also for the outcome and the registrations. So I think the ERNs could play really an important role in this, because we did it for SCID, but I think similar approaches can also be valid for the other screening programs. So maybe also Rolf can comment on that, because you are more from the screening side. Maybe you can reflect on that, Rolf.
Hello, no, I really agree. And I think this is really a challenge that we have to talk about. And I mean, Jim said something about trust in the families that we work for, and Maurizio also mentioned that it is really important what we do. And I think that you can see different views, even from professionals, if they have been doing and working with screening for a long time, or if they haven't, because I think they regard a false positive a little bit differently. And this is something I have really understood while jumping into the field of primary immunodeficiencies, which is not my background. I have a similar background to Maurizio, and as a pediatric metabolic doctor and endocrinologist.
Thank you. Sorry, Rolf, please finish.
No, I think it's
good. Yeah, then well, that certainly was the study of Mirjam was a very nice spin-off of a conference we had earlier this year on SCID screening, and it is an example how we can deal with case definitions. We're running out of time, so I would like to have very short comments of Giancarlo and Kateřina, and then I would like to hand back to Johan for maybe one last question. And then I think it's time to see whether there are questions in the audience that we could relate to the panel and to Jim. Is that okay, Jim? Johan, is that what we're going to do now?
That sounds good.
Okay, so very short answers from Giancarlo and Kateřina then.
Okay, thank you very much. I'm really learning a lot of things today, and just a small comment on genomics and the revolution of genomics. Genomics is a quite complicated word, I think, and we have to pay attention, but we are still using molecular biology in newborn screening field. It's not the future, it's the state of the art. We are using molecular biology for cystic fibrosis, for SMA, and also for SCID. Therefore, I believe that the information and the formation of parents is a critical point. And we have to give right information in the prenatal period to families and involve them. We are discussing about a multidisciplinary program or system, and that's the meaning. We are all together, families, professionals, and we are using molecular biology as confirmatory testing. Confirmatory testing is a part of newborn screening program, and that's a fact. It's not the future. It's the state of the art.
Thank you, Giancarlo. Kateřina.
Thanks. Only shortly. But just so it doesn't look like anything's happening in a European Parliament, I think that we so need to say that the topic of rare diseases, the research and development of orphans and screening is slowly, but being promoted in all legislative documents that we are discussing today as a part of so-called Health Union package, especially after the pandemic. There is a great will to adopt a new legislation in this area. If you look at the latest voting on a new EMA or ECDC mandate, or the compromise on the INI report on the pharmaceutical strategy for Europe, you will see that the topic the topic of rare diseases is significantly present in them. That means that yes, it's a win, but we want more. Everybody understands, but it's not so that the rare disease is somewhere. I think that we with Eurod is doing a great job, and we will continue with it.
Well, thank you. That's very encouraging, Kateřina. Jan.
Thank you. Three short comments. First, well, discussion shows that we absolutely need this expert forum steering committee with member states, experts, or stakeholders. So it would be fantastic if the Slovenian presidency was elevating that to the EPSCO meeting in December, if you think that's what fit for purpose for member states. My second comment is on the point on how do we define conditions. I'd like us to be very careful not to be systematic in the equation, newborn screening, expensive treatment. No, definitely no, because first there is treatments which sometimes are not expensive. May I take familial Mediterranean fever, for instance, where we still don't have newborn screening. It's very cheap and it can really improve the life. So what we're saying is that we need to look at health outcome and social outcomes, and that in fact, if we were looking at these diseases where health outcomes, social outcomes can be improved thanks to newborn screening, we will then not have that equation with the expensive treatment. And my last short comment is to say that I fully support the comments of Professor Banham and Mr. Cystic about the trust, and it's a treasure to protect. We need to be very careful in the design on how we scale up newborn screening so that the population maintain that trust even when moving toward more genetic screening. But also I would like to mention, in reference to the colleague from France, that I don't see a problem of having family refusing to do newborn screening with genomic technologies. And maybe that's also something we need to think of. that maybe we need that kind of freedom, that people have the right to choose to be vaccinated or not vaccinated, have the right to choose to have newborn screening for their kid or not, that this is private choices, exactly like we accept that there is no blood transfusion for some families for religious reasons. We may not like it, but still, we're a society where everyone can have his own convictions, and I'd rather go in that direction than imposing things on the population, which will slow down the overall process. Thank you.
Yeah, thank you for that comment, Jan. And now back to you, Johan.
Thank you. I'll be very brief, Peter. I think we've had an excellent discussion. I think it shows we could have gone probably for another few hours because there are so many aspects that are so important. I think if I would summarize some of the discussion, we've heard a lot about the clinical and scientific and research role that the European Reference Network can play. And I think that is definitely one of the pathways in which the EU can help. And then the other pathway is obviously the policy related pathway, which is very important. And I fully agree with what Jan has said about the importance of having a standing committee. I think that has come through a lot in the presentations already and makes sense in light of the discussion that we've just had. I would say my final observation, and maybe if there's a rapid comment, that'd be great. But obviously today, I think for me is an event that should be seen as a stepping stone for more at EU level, more action at EU level. We have, I think, two people with us on this chat, and maybe Ms. Konečná has no left, but from the Czech Republic and France, which obviously are two member states who will be part of the next presidency trio. And I think it would be great to continue what Slovenia has started with this event and their support when it comes to the future presidency trio. And that would be my closing comment. And perhaps David Chelon from France has an observation on that to close up before we pass on to Jim.
Thank you for that. There is a huge work for the future. So if we could continue something, it will be with a good pleasure with everybody, of course. Thank you so much.
Excellent. So Jim, I realize we don't have so much time, but we have a few questions from the audience, I believe.
Yes, let's begin to move into that now, Johan. Thank you for everyone that's contributed to that. We could have talked all day, but we want to make a bit of time now to hear from the audience, those who are registered as attendees and who can put questions in the chat. And I wonder, Johan, what do you think? Where should we start with that? Are there some questions in the chat?
Yes.
Yeah, I think we could start with one from Eugenie Facer, if I'm pronouncing that correctly. And she says, the UK is already embracing the genomic revolution, and Genomics England has started a public dialogue on the UK about the use of whole genome sequencing in clinical diagnosis through the NHS and in the future for NBS, so for newborn screening. And then it's her plea that the EU should take some lessons from such an initiative. That kind of rings a bell with what Eugenie Dekkers just mentioned, that in the Netherlands there is this vision on the next 10 to 15 years on newborn screening. So how, I guess the question to you, Jim, and panelists is, how are we going to collect all that knowledge that is already there and not available for the European community as a whole, and we as professionals as a whole? Jim?
Yeah, I mean, I think I would say, please don't take lessons in the EU from the UK. They're not always good lessons. That's probably the first thing to say. But on a more serious note, I think we do have to learn from one another, even the UK. And we've got to collect that information and store it. And that's part of the work of Screen for Rare and the Health Technology Platform, to be a trusted repository for information. Coming specifically to that work of Genomics England, I think it would be wrong to say that the UK had embraced genomic testing as a way forward for newborn screening. It's certainly keen that Genomics England is quite keen to explore that. And they did do an extremely useful public dialogue, and that's available on YouTube. It lasts 1.5 hours. If you haven't listened to it, then please do. And what the public in the UK at least felt was that they were interested and optimistic about embracing genomic technologies. But if they did, they recognized that this could be a real shock for parents, and parents would need to be very carefully supported and prepared to engage in that form of testing. And we went on to use the same team, actually, interestingly, to explore the use of next generation sequencing in cystic fibrosis, which was much more defined, just to go from the IRT then onto DNA, but not the limited panel of mutations, using the full power of next generation sequencing before we came back to IRT. And that was really interesting, because what that same public group that had offered input into the consultation organized by Genomics England, what that group said, of the public said, they started off thinking, well, this is great. And then as the series progressed, we did this iteratively with experts with the same public group. They moved from a position of unbridled optimism to much more caution. In fact, they finished with prizing certainty over sensitivity in screening. And these were not, as I say, these were just members of the public. And that taught us a lot, because what the question we were asking them is not whether we should do it, but how should this be used? Should it be used only to identify certain cases, or perhaps used a little more comprehensively if there was any form of risk? And progressively, the public moved away from any level of uncertainty to only uncertainty for clearly treatable conditions. And I think that was really important for us. And I suspect as we move on in the genomics revolution, what we've got to be really careful about is that when we're talking about newborn screening, we're talking about community-based activity in which we're reaching out to families with well children. Yes. And the crucial thing is to protect those families. If we can then go on to identify children with disease, then of course we must, but we must not lose this huge confidence and trust that the public have placed in us to protect the families with well children. That's got to be our first responsibility. Do no harm. If we can do good as well, then that's great.
Jim,
thank you, Jim.
Yeah, and if I'm just, if you allow me just one more minute or maybe two to make a little bridge, Jim, we've in the discussion we have now discussed newborn screening and neonatal screening on so many levels, on the level of how to engage with the public, how to build trust in neonatal screening programs, genetic screening, biochemical screening, etc., etc. And we all try to move that into a more European realm and area, so to speak. And you, for one, have said that we actually need a standing expert committee for newborn screening in Europe. And it's been alluded to in several presentations. Could you just give us an idea of how you think that should work? And then maybe some of the panelists could comment on that as well. Let's take 2 or 3 minutes to do that.
Yes, I'm going to hand that over to the panelists. I think that we need an expert committee that really doesn't just talk to ourselves. I'm very conscious that on this group, we've got a lot of people with an interest in newborn screening, a lot of support organizations with an interest in newborn screening. We've got some politicians, we've got relatively few members of the public, and I suspect no health policy decision makers. And so we can talk to ourselves endlessly about what we think are good ideas and the way that we should progress newborn screening. But unless the health policymakers in our European countries are asking the questions and listening to the answers, we will simply be talking to ourselves. So I think the first thing is to have an expert group, but it's an expert group that should be built around and formed around the needs of health policymakers. But I'll pass over to the panel as to what kind of group that would be.
Yes, so I think that there's three important questions. Where should that expert committee be housed? As a separate organization or next to another European organization, and who should be in it? I think for the next few minutes, we can discuss that and maybe not more. So who can I give the floor? Maurizio, you have a strong opinion on this.
Yes, thank you very much. I think that it is, as I said before, it's very important that we have this newborn screening expert group, because a lot of activities, a lot of awareness has been raised in the past 3-4 years. As we said, there is a lot of technology, there is a lot of other important issues that need to be addressed as a circle and as a system. Again, I think that the ERN can be the right side to do this, because we have all the disciplines that are indeed necessary. We have also contact with patient organization, with Orbit First, and all other organizations like POPI and other big ones. And we have also the support of the European Commission. Furthermore, we have also a vision because the ERN is a program, is not a project, so we have long-term actions, and we can apply, also to competitive programs for artificial intelligence, as we did just in September, 5 ERNs all together for an important action. Mm-hmm. So I think that this could be really the right way to go, and we are very keen in helping and facilitating this, because it's really an important issue.
Maybe Kateřina, could you, in your wildest dreams, or maybe not so wildest dreams, think of a possibility that we were able to realize such a standing committee?
So it's a difficult question, yeah, because yes, in my dreams could be, and in my dreams is many things how I can help this topic and the people with rare diseases, because this is, I hope, something when I could be useful. But yes, we could try. But in another side, I don't want to give you only my dreams. Yeah, that means that, as I said before, it's step by step. You need to change. Now is the time to change many things, because many people in the European Parliament interest about the health issue topics. That is something what's we haven't from the beginning, yeah, because last mandate, for example, interest about this topic only 7 people maybe from whole parliament. Now it's situation another. But the truth is that it's not will be easy, and it's not will be next month. But yes, we could cooperate on it, and I help you as is possible.
Well, that's great to hear. And I learned from Maurizio's presentation that it took about 10 years before legislation to realize the ERNs got from the first grassroots initiatives to legislation. So we may lend ourselves some time. Back to Johan.
Thank you, Peter. And I'm not sure whether I should go back to Jim, because I know we are running a little bit over time and reaching, I think.
Yeah, maybe we should work to a closing. Could also be appropriate. I think we have 5 minutes left, have we?
I mean, Jim, maybe just to say on the basis of the other question, there's certainly support for this expert group on newborn screening. I think that has come through a lot of the question and a suggestion to update the Council recommendation for rare disease and include that. There was also a couple of questions about impact of family, but I think from the genetic screening, I think you covered that already, partly at least, in your previous response. And then probably another one was the importance of awareness and how we can raise awareness together, because we are all stakeholders from different sides of the topic of newborn screening, but all really wanting to push the topic forward, and that might, that creates an opportunity to do things together. I mean, certainly part of my answer would be to look at the International Neonatal Screening Day, which has been held for the first time on the 28th of June of this year, and obviously will be held again in the years to come, and that might create a momentum in our calendar for 2022. But I think, Jim, maybe would be time to go back to you with some concluding comments to this session. And thank you, of course, to all the panelists and to Peter, my co-moderator.
Thank you, Johan. And yes, I think it is time to begin to draw things together. It's been tremendously interesting this morning, tremendously interesting to see and hear what's happening in our various countries. And of course, these are only a selected few. There's a lot going on in countries that we haven't had the opportunity to hear from this morning. I mean, I think to try and distill this, I think we all see the value of newborn screening. We rejoice in the fact that it broadly has strong community trust. In countries where this is optional, then the uptake rates are extremely high, the coverage is extremely high. And so the first thing we've got to do is to continue to value that and protect it and build confidence and trust, and don't take that for granted. Build confidence and trust with politicians and with the public. I think we are going to see new technologies, and so I think, like it or not, I think we've got to try and take advantage of those. But as I say, like it or not, it's probably down to us, the newborn screening community, to see where those new technologies fit into newborn screening, with all the potential benefits, but also some risks attendant upon those. A key way of doing that is to be inclusive. I've seen one or two chats in the comment there about having a widely drawn expert group, including ethicists, including payers, including policymakers, alongside those of us that are advocates for newborn screening. I think we need to provide, if we can, unbiased advice, certainly unbiased from commercial interest, but also to some extent a step back from the urgency which individual patient organizations would perhaps attach to their disorder. That's not to dismiss them. The patient voice is hugely important, but I think we've got to take a slight step back and try and look at newborn screening in the round, because of course, when newborn screening is presented to a family as an option, then it's a series of tests and not just a test for an individual condition. We've got to be careful that we don't talk to ourselves, and that we include, particularly, as I say, policymakers. And I think we've got to be careful, and Peter touched upon it, that this is not a sprint. This is a marathon. This is something that we're going to build carefully and methodically, year after year after year. And we're doing that at the minute. We've had a series of meetings. We mentioned that meeting, which was the ERNs in September. We've got this meeting today. We've got a meeting in a month's time in Luxembourg, and that's not chance that these things have happened one after another. And then we hope to have another ERN meeting in January. But that's got to be supplemented, this talking's got to be supplemented by documentation. And so Peter and others working with the IJNS, the International Journal of Neonatal Screening, are intending to dedicate a special issue that I long for all of you to contribute to, about screening practices in Europe, so that we can get some of the things that we've talked about this morning into peer-reviewed published journals for the long term. This is a marathon and not a sprint. And of course, Johan's already mentioned, please do begin to think now. If you don't think now, it will not happen. Begin to think now upon the events that you're going to be involved with and perhaps help organize for June the 28th, 2022. I think I'm going to finish where we more or less began, that the crucial thing is to get together an expert committee but not just drawn of those of us who are already convinced, but an expert committee that enjoys a degree of recognition by the European Commission, that enjoys political support and is widely drawn. And that's what we'll be turning our attention to again and again over the next 2 or 3 months. And I think that's where where I'll leave it. We've got a lot to celebrate. We've got a lot to do, and we've got to plan and work together and really trust one another. We cannot engender trust from others unless we trust one another. So let's press on together, and thank you hugely to and the Slovenian team who have organized this, to the politicians, Kateřina and Manuel, who have been present and offered support and encouragement. And of course to Tadej for hosting this on behalf of Slovenia. So thank you very much. It's been a hugely beneficial morning. Thank you.
Yeah, I would also like to thank everybody for this early great energy with this meeting and for good attendance. And I'm looking very much forward that it will continue like this.